Hello, my fellow ortho enthusiasts, and welcome to the Seaview OrthoPod Cast, where we cover everything orthopedics to get you back to quality living. I am your host, Layla Jabbar, and you are joining us for episode 2, season 2. Today, we are going to be breaking the ice and talking hockey. Listen in to hear all about the common hockey injuries and prevention tips. Much like a rink, this episode will be very cool. On this episode, we are joined by Seaview Ortho's very own Dr. David Junkin from our sports medicine team. Dr. Junkin is a board-certified orthopedic surgery specialist and specializes in arthroscopy of the knee, shoulder, and ankle, including ACL reconstruction and rotator cuff repair. He also performs joint preserving and joint replacement procedures for arthritis of the knee and shoulder, including reverse total shoulder replacements. He is also the team physician of our friends, the New Jersey Titans of North American Hockey League. And our very special guest today is Jim Dowd. Jim is the first and only New Jersey native to win the NJSIAA Ice Hockey High School State Championship in 1986 with Brick High School, an NCAA D1 National Ice Hockey Championship with Lake Superior State University in 1988, and a Stanley Cup in 1995 with the New Jersey Devils. Jim played 17 years in the NHL, and he owns a nutrition business. He also does performance mindset coaching for youth athletes. Jim has been married for 26 years and has 2 sons, Jimmy Jr. and Anthony. Hello to the family. All right. So we know hockey is a collision sport, and you can expect a higher risk for injury. For players, parents, and coaches alike, it is important to be aware of the most common injuries that can happen on the ice. Since there are so many injuries that can happen in a hockey game, we are only going to focus on 4 of the common ones. And since I'm even sick of my own voice at this point with those long introductions, I'm going to pass it to the experts. Jim, many of the collisions that we're going to start with separated shoulder. So many of the collisions that cause a separated shoulder, do you see this injury a lot as a coach? Is it from getting checked? Like, is it something that you see a lot on the ice?
Well, that's a good one to start with, being that I had both of my shoulders done. So due to hockey.
Man.
Yeah, very common one. I had my rotator cuff done and the ball and socket in 94/95. It was subluxing. I went to Lake Superior State University from 87, 88 to 90, 91. And for the last, my 2 years, my junior and senior year, it would sublux, come in and out. I was using a harness, and then I signed pro. And for my first 2 years, first 3 years, so for 5 years, it was subluxing. And then it got to the point where, I was falling asleep in a chair like this and it would be out. So I eventually had to get that done. Wow. But it's a very common injury in hockey. And I had my labrum done, 05/06. So wow. Yeah, very, very common shoulder injuries, especially in a sport like hockey.
Is that typically from like getting checked? Like, what is that usually from?
Yeah, most likely from reaching for the puck, getting hit in an awkward way. Or I remember I was playing with the Chicago Blackhawks when we were playing the Calgary Flames. I was coming down my off wing. I'm a right-handed shot, so I was going to the left wing boards. And one of those, I knew I was going to get hit. And if you pull up, you're going to hear it from the other team. Not too nice words, but I remember I had to go in and take the hit, and he just crunched me awkward. Dion Phaneuf, one of the biggest hitters at the time. And that wow. I finished the season out, but I eventually had to get my labrum done. But basically, from getting checked or just being in an awkward situation.
Wow. And Dr. Junkin, as a surgeon, is hockey one of the more common sports to see this type of injury?
Shoulder injuries are very common in hockey, as Jim was alluding to. And most of it is from the collision nature of the sport, particularly when the player goes into the boards. Separated shoulders typically occur when the shoulder gets depressed. The player goes into the boards almost head first, striking the shoulder, having the arm driven down, and then the joint at the top, called the acromioclavicular joint, is what is damaged, not the ball and socket joint. And then the collarbone can stick up. Very common. Unfortunately, that injury, though common, doesn't typically cause a lot of loss in play time.
Oh, really? Wow.
There's different stages of the injury. There's grade 1, which is very minor, all the way up to grade 6. But really the ones we really see are basically grade 1 through 3. 3 is a complete separation of the joints, and even with that, in the NHL level, many of the players get back within 3 weeks after that injury. Typically, if it's a more advanced injury, then you can have more muscle injury that causes pain, and that could lead to surgery. We try not to do that in the high-level athletes because they miss a whole year, not just a season. They can miss a whole year with these type of injuries because it just takes that long to rehab and regain the strength, and more importantly, that area to heal.
So that treatment plan is really going to be dependent on the severity of how.
Oh, absolutely. You know, you and Jim might even be able to test this, but you can go into a hockey locker room. You see all the players have these AC joint injuries with elevated collarbones. You know, so hockey, football, lacrosse, we see on a lot of the collision sports.
That definitely makes sense. And not to scare any hockey players, but do these type of repetitive injuries cause arthritis down the road for these athletes?
Typically not in that joint. Arthritis to the end of the collarbone is extremely common. Pretty much everybody gets it through age. But the injuries to what we call the glenohumeral joint, the ball and socket, that's a whole different matter. So sure, if there's an injury to that joint, you know, labral injuries are very common as well because it's a distracting injury. It's the nature of the sport. Again, the collision. And, you know, anything that involves surgery of the joint can open the possibility of arthritis down the line.
So, Jim, since you had both of your shoulders done, how are your shoulders feeling these days?
Yeah, it's pretty funny. Like my right shoulder, no problem whatsoever. That was just the ball and socket. And, you know, Doc was exactly right that they try to avoid surgery. You do as much rehab as you can without doing surgery. And then it gets to a point where eventually you need it. But I was back within actually 8 weeks playing. You know, that was back in 94, 95. That was just a ball and socket, though. I mean, and I was with the New Jersey Devils at the time. I think I didn't go to rehab for one day, you know. But right shoulder's been great ever since. The labrum, you know, I had that done in 05, 06 when I was with the Colorado Avalanche. And that healed fine as well. You know, the biggest key is when you're rehabbing, just don't miss. I mean, it's a little different when you're a pro athlete. I mean, you have it all right there at your fingertips. You know, you go in every single day. You know, you're basically on a schedule and you can't miss. That was one of the benefits, obviously, of being a pro athlete. But there's tons of people, and I've referred plenty of people to Seaview over the years. And the biggest thing I say is, whatever you're getting surgery, just don't miss rehab. They put you on a schedule. Do not miss, because you'll just put yourself, you know, it's like missing an accounting class for one day. You miss one day, you're behind a week.
Right. Being compliant is so important. So we're going to move down the body. Groin pulls. Groin strains account. Yeah. And the funny thing is, I played soccer, so I read the statistic. Groin strains actually account for 10 to 11% of all injuries of professional ice hockey and soccer players throughout the world. So I'll propose this question to both of you. Why do we think this is so common in hockey specifically?
Just because it's what you're using, and you're skating the whole time. That's what you're doing. You're constantly, and you know, and soccer as well, because you're constantly going left, you're constantly going right, forwards, backwards, all over the place. Those quick movements. And you know, the one thing I've learned over the years too with that is just you have to rest up. Do not try to come back really from a groin injury, or you'll set yourself back big time. And Randy McKay, for those Devils fans out there, he ended up missing almost half a season one year when it only should have been probably a month and a half, because he kept trying to come back too early.
Yeah, it's strictly the nature of the stop and start, you know, and any sport that's high speed, like soccer and hockey, planting, turning direction, you know, whether you're on skates or, you know, using cleats on turf, it's just the nature of the movements. And then there's a lot of stress in those muscle groups. They're large muscles. You know, people can easily have injuries to those as a result. You know, in younger athletes, you can even see the occasional bony avulsion, but that's more in the young athlete that's still growing. But yeah, these injuries can be devastating to the athlete and just take a long time. And like Jim said, I tell patients right away, this is going to take longer than you hope. And do not push it, otherwise you will miss more of the season.
Oh, certainly. I can attest to this with my soccer injuries. It seemed to be the one that you think you're going to be able to come back from in a couple weeks, and you tweak it and you're just right at square one all over again. And I don't even think mine was very serious. It's just like these minor ones even take forever. So in speaking about severity, how would a patient be treated for this, you know, if it was a more severe groin pull?
Well, just regardless of the severity, it's first rest.
Right.
You know, muscles, you know, when they first happens, you want to ice the area down. There's going to be a lot of swelling in that muscle, and there's going to be potential little bleeding too. We want to make sure that we get that under control, and that's why people have bruising. It's just the bleeding of the muscle from the muscle fibers tearing themselves, and that, the worse severity, the more bruising potentially, and the more the muscle is then damaged. But yeah, it's shutting it down for a good 48, 72 hours, sometimes longer if the severity is higher. And then you start introducing heat and gentle stretching, gentle motion. And I stress the word gentle. The mistake with muscle injuries is people start moving that body part way too soon, and it's just not ready, and then it just sets them back. And certain muscles too, you can't move too soon because there are other conditions that can develop, which would be more devastating.
So realistically, coming back too soon from this, really anything under 4 to 6 weeks, you would have a very high potential of re-injury.
Yeah. Well, again, there's the minor kind of, I stretch the muscle and it's in you need a couple days to a week it could be a season-ending injury. So there's a large scale of injury when it comes to this, but we're always cautious. Patient has to be pain-free for pursuing athletic activity.
I am curious. This is just a question that pops into my mind. Is it more common in males or females? Is it?
Not that I'm aware of. We see it a lot in the, athletes like hockey and soccer, just because of the demand on that athlete. So the lower extremities, for the most part, are some of the strongest muscle groups in their bodies. Now, and as a whole, that's true. But then you talk about these athletes that are skating and running, that these are very large muscles. It's just, they can take its toll and take time to recover.
Right. All right, we're going to keep moving down the body. What do we think is next? Knees.
Yeah.
So we're actually going to specifically focus on the MCL knee injuries. So Jim, as a coach and being around hockey for so long, do you feel like you almost have a sixth sense, or that you can tell the severity of an injury taking place while you're watching it happen?
With the knee, you're hoping and praying that it's not exactly like you're talking about the ACL. If you're going to hurt one, doc, right, the better one to hurt is the MCL, right?
That is correct.
That's correct. Yeah, and
it typically heals very reliably.
Yes, the ACL, that's the tear that guys are out for 12 months. The whole season.
Yeah, they're out. Yeah. With hockey, they'd miss a whole year, I would say. Yeah.
When you could tell when it happens a lot in hockey, because it's such a fast moving sport, and there's a lot of knee on knee by accident. There are some that's on purpose. But yeah, that's pretty common. And I only had one MCL little sprain, and I couldn't believe it. It was in Madison Square Garden. They're known for terrible ice there.
Really?
Yeah, a lot of ruts in the ice. Great place to play. It's New York City. But I remember playing there when I was with the Minnesota Wild, and I caught a rut, and I couldn't believe it. I was like, you got to be kidding me. Like, I never had a knee injury in my life. And I missed 3 to 5 weeks, the minor MCL sprain. And that's another one of those, doc, where it's just going to take time. Let the swelling go down and start your little rehab with the bands and all that. And it was literally 3 to 5 weeks, and I was back, and no problems ever since then.
Wow.
Yeah, they've done a lot of research on the MCL. It's the most common ligament injury of the knee. There's now more of an accelerated rehab protocol. We used to really guard the individual and prevent weight bearing, but we're now beginning early weight bearing. And it depends on what facilities they go to recover. Aquatic therapy has just been wonderful, the MCL, because you can get them walking, in water where they have the buoyancy of the water to reduce the stress. But most importantly, it's just avoiding the stress on that ligament. And again, the severity is anywhere from what we describe as a grade 1 through 3, where a 1 is just a minor stretch, a 2 is a partial tear, and a 3 would be a complete tear. The medial collateral ligaments most commonly tears at the origin off the femur. Fortunately, that's very reliable in healing. There can be an injury elsewhere in that ligament, which can be more detrimental and even require surgery, but fortunately, that's less common. When you talk about the other ligaments of the knee, the ACL, not as common in hockey just because of the nature of the sport. The knee is basically bent. The skating, you see it more where an individual has to plant and change, like soccer or football, basketball. So it's just the nature of the sport. The other ligaments of the knee injuries are fortunately extremely rare.
So MCL versus ACL, how long is the difference of when an athlete would be out for?
One ACL is going to require repair or reconstruction.
Right. Okay.
It's a surgical treatment, where an MCL is in isolation, very rarely needs surgery. You're talking a minimum of 6 to 8 weeks.
Wow.
Typically, and that's for the grades 1 and 2s. The grade 3s, which is the complete tear, that could take a little bit longer. But we really restrict the individual for at least a week or two, and then get moving pretty quickly, depending on the extent of the injury.
It's just so interesting because I had no idea that, I mean, in soccer, you could like twist your ankle on the field, but I had literally no idea that there were injuries from the ice in hockey. That is something I've had no idea about. So learned something new today. Thank you, Jim.
Seaview Sports Medicine is a division of Seaview Orthopaedics. With our team of fellowship-trained, highly specialized orthopedic surgeons and primary sports medicine doctors, we treat all level of athletes and the athlete in all of us. If you or someone you know suffer from an injury, or you're looking for a consultation for a concussion, schedule an appointment online at seaviewortho.com or 732-660-6200.
And we're going to move down the body to the fourth most common injury that can occur during hockey. So ankle sprains, which blew my mind because I was convinced that the skates supported the ankle. And I guess that's a misconception. I'm not alone in this thought process. I did not play hockey, but I always thought that your ankles were supported. So Jim, this is probably, something that you see often, but like how often would you say in your athletes that you're seeing sprained ankles?
Yeah, quite a bit in hockey, because again, all the stopping and starting, you're going into the corners, you're cutting back, you're battling with another person, and it's more common than you think. Or you lose an edge, you're going into the corner really hard, you go to turn, you lose an edge, you slide into the boards, and the first thing you do is you put your feet to brace yourself.
Right.
So that's very common in hockey.
Interesting. And is there any support? Like we used to tape our ankles in soccer. Do they do that for hockey as well?
You don't need to. I mean, it's some guys do, but very rarely. That's old school hockey. Guys used to tape their ankles, but I honestly don't think there's anybody that tapes their ankles anymore in hockey.
Wow.
Yeah. Well, taping has been proven to be ineffective.
Great. So all of my trainers were not doing the right thing.
Usually by the time the athlete has done warm-ups, the tape is rendered ineffective.
Wow. Very interesting. So what do they do now? Do they do anything?
Bracing has proven to be very effective, because the difference is with a brace, these lace-up braces, a little hard to fit in a skate, but you can work around that. Can be adjusted throughout the game.
Okay.
Whereas tape, once it's kind of loses its effectiveness, then you got to retape.
Right. Okay.
You just can't do that on the fly like you can with the tape. Now in hockey, we do see a different type of ankle injury. It's more that high ankle sprain, which, Jim, you could probably...
high ankle sprain, very common. And guys get so annoyed by that, because another one, there's really nothing you can do but rest.
Yeah, that's a much longer recovery process. It's a different ligament complex in the ankle. The more common injury are the ligaments along the outside of the ankle. And people can recover in a matter of a few weeks from those, depending again on the severity. The high ankle sprain, if it's severe, it can require surgery, because it's a tearing of the ligament. It's a separation of the bones.
Too, right, Doc? The guys get so annoyed at that, they think they're going to come back in no time, and it's like another week, another 3 days, another 5 days.
Now, there's bracing for the high ankle injury, which I have found pretty much ineffective for running sports, but it's been somewhat effective for hockey, and that's again because of the skate. Does provide the added protection. But the difference in that injury, instead of the ankle rolling, which is the traditional injury, it's actually a twisting of the ankle. So it's not the connection between the leg bones and the foot. It's actually a connection of the two leg bones at the base of the leg.
Oh, wow.
At the ankle, just above the ankle. That's why we call it a high ankle sprain.
Okay.
And so when you bear weight, those ligaments being damaged, the tibia and the fibula bone can separate if the injury is severe enough. So that's why that's typically a surgical intervention if it is that severe.
And how would a coach or a parent or an athlete know the difference between a high ankle sprain versus a regular ankle sprain?
Well, off the bat from the initial evaluation, a lot of times it doesn't have as much swelling.
Okay.
The pain's in a different location. It's a little bit higher. So yeah, the trainer should be able to identify it because of the location of where the individual hurts.
Okay.
And, a lot of times you're able to witness the event and say, all right, is this, an ankle rolling, or was this more of a twisting, the foot rotating out exteriorly, which would lead to more of the high ankle sprain. Now, if they have pain up by their knee or below their knee, that's where you worry that they have now a fracture above, which is called a Mason-New fracture, and that's usually more severe because now they have a fracture above, and then the ankle ligaments are typically then torn, and they require surgery.
Excellent. And we're going to move just to a few more questions here, but I'm going to propose these to both of you, and we're going to move away from the top 4 body parts or bodily injuries. So both coaches and physicians take a role, obviously, in injury prevention. So I'll propose this to both of you. How are athletes educated in injury prevention?
Well, yeah. All right, I'll go ahead. Yeah, we talk about this all the time. And, and I have kids that come in, once they've recovered or the parents, it's usually, how do we prevent this from happening again? Now, again, it depends on which body part you're talking about. There's numerous strategies for the ACL. There's numerous prevention programs, and they've proven to be very effective. The important thing is making sure the athlete is ready for participation. They have to be in shape. It's that simple. When do most of the injuries occur? Pre-season. Because they come in, now the higher level athlete's going to know to be prepared to get in there. But, we see with the high school level kids, they take the summer off. Then they go right into the sports camp, and they all come in with all these, overuse injuries. And then they're more prone to having these acute injuries like the ones we talked about because they're just not ready. So they have to, maintain a level of fitness and then slowly increase that level of fitness. And then even in season, you have to maintain a certain fitness level. Now, obviously, like a sport like hockey or soccer, you're constantly doing that. But there's other sports, football, for example, you have to keep lifting. You have to, you don't lift off season, then you just stop when you get in the season. No,
right.
You're not going to maintain your muscle tone. But it really depends on the body part you're talking about. But it really comes down to preseason preparation, then maintenance in season.
And Jim, do you guys at your facility take an active role in like injury prevention and, teaching the athletes, I don't know, either after they have the injuries or prior to the injuries, what they can do to like stretching, anything like that?
Yeah, they have a great facility over there, the Sports Performance Lab. Andrew Watkins runs that.
Beautiful, by the way. I have toured it. It is state of the art.
Beautiful facility, and they're so far ahead of the game. I mean, I'm 54 years old. It's night and day from when I grew up, as opposed to now, and Doc as well. I don't know how old you are, Doc, but I'm not saying. But it really is night and day.
Years younger than you.
Yeah, but Doc said it's you got to come into shape. I mean, you used to go to training camps to get into shape. Now, if you're going there to get into shape, I mean, heads up. Because everybody's flying from day one.
Mm-hmm. And for hockey, are your kids like full year?
No, my boys, well, now they are. I mean, my oldest son, he's a junior at Penn State playing hockey.
Wow.
He's going into a senior year next year. My youngest son, Anthony's out in the USHL. It's the top junior league in the country with the Chicago Steel, and he's going into ASU next year as a freshman.
Oh, awesome.
He's got to be out. Yeah, so he's got to be out there for a month. All the freshmen have to come in for a month to train specifically with the strength coaches out there. And then he gets to come home for 3 weeks and then go back out. So basically going into their freshman year, they have 3 weeks of summer. I mean, that's how much things have changed over the years. Again, I went to Lake Superior, 87, 88 was my freshman year. I just had to show up, September 2nd or something like that.
Yep. I remember very vividly showing up. I mean, high school and D3 college, but it literally was vomiting on the side of the field because we were just not in shape. And we were trying our summer conditioning practices, and it was, I wish someone had told me then. I probably wouldn't have listened, but I wish someone had told me then to stay in shape all summer.
I was guilty of it when I played football in high school. I got shin splints every football camp.
I remember those.
Oh, God, brutal.
Yeah.
And yeah, you get there, and after the first day, you get up the next morning, and you can't even get out of bed, and you're, 16, 17 years old?
Yep.
No, that's, we got to stress, we stress to the kids, you just can't let that happen. Don't do what I did.
No, exactly.
Learn from my mistakes.
I mean, it's amazing that they don't really have to, not have to worry about the same things, but that has to technology and education has come so far where, they are getting educated better. I mean, it's everything.
And the level of competition is just going up exponentially. It's just, I'm glad I'm not.
Same.
Man, it was a lot easier back then for us.
We had a lot of fun.
But, yeah.
Yeah, back then you showed up, someone's father coached you or
Yep.
mom coached you, whatever sport it was, you showed up, they taught you to work hard, be on time, and that was it. Go home and keep your mouth shut. That was basically it.
Yeah,
And
a lot
you
more
played,
laid back.
it wasn't full year. It wasn't, you played football and football season, wrestling and wrestling
Mhm.
season, hockey and hockey season, baseball, it was, I think soccer was the first sport actually that went year round.
Yeah.
And little by little, you got fall baseball now, you got spring. Spring hockey right now is just as popular as winter hockey.
Right.
But still, I truly believe it's good to take some time off or whatever you're doing.
Well, because we've talked about this with like baseball, how you get those like repetitive injuries. That can't be good for the kids, especially with their growth plates and growing.
Yeah. Sports specialization the age is dropping significantly, and as a result, we're seeing significant injuries. It is recommended that kids play 3 different sports throughout the year if they want to play year round, and have 2-3 months of no sports. How many kids are doing that now because it's gotten so competitive? Baseball is a great example because of the mechanics of throwing. You have these young kids, they're playing sometimes on 2-3 teams at one time, and they're trying to pitch for all these different teams. It's insane what we're seeing. And I tell them, you got to shut down. If you want to pitch when you're in high school,
Right.
Can't be doing this while you're in middle school.
And forget high school. You're talking
Oh,
your college career. What does that even look like if you're pitching in middle school,
Yeah, well, a lot of these young athletes, one of my first questions is, what is your ultimate goal? Do you plan on playing your sport collegiate level and maybe even beyond? Yes. Well, then you take care of yourself now.
Right.
Granted, you should take care of yourself now regardless, but you got to think more long term, which is really hard with a young athlete. I got to get ready and be back for the next game.
Exactly. And you can tell a young person anything today. It doesn't mean, I had to experience a lot of things to actually understand much later in life. But if you had told me when I was 16, I wasn't going to listen to anyone.
Yeah. Well, I always tell them it's better to miss one game than half a season or a whole season.
So I'll ask Jim this. So what is the old school, not so much the new school with kids starting younger, but what is the typical lifespan of a hockey player? Like, what is the career length usually?
Professionally?
Yeah, let's start with professionally.
I'm pretty sure baseball, football, basketball, all the, pro sports leagues, probably on average, it's about 4 years for each sport,
I always thought hockey players were a little bit older. Is that a misconception?
Well, no, actually it used to be that way. Now it's a young man's league because the way they changed the collective bargaining agreement, all that, there's more young kids than ever now. I
Wow.
was fortunate to play till I was 40, but that's sort of unheard of, so guys are getting up into their early 30s, mid 30s, and they're done now. Whereas before it used to be the NHL used to be a veteran league. If you had more than one rookie on your team, that was a lot. You had to put
Wow.
your time in the minor leagues and work your way up, but there's more young kids than ever now. And that it's because it's the business side of hockey.
Right. Which it seems to be the way in a lot of professional sports. So one final question for the both of you. Seaview, as I stated before, is the official orthopedic provider of the New Jersey Titans and Middletown Sports Complex. What is the importance of teams having this kind of relationship with physicians? Why is it important for the complex and the teams, and why is it important for the physicians? How is that relationship important to both?
I guess I'll start. I'll let Doc finish. I think it's great because when you can trust a place like Seaview, you know what I mean? And the access that we have right away, boom, we could just bring kids over there just right off the bat. And the success that we've had working with you guys is second to none, and it's the comfort factor too. We're the kids that are new there because they have the academy there, kids from all over the country, actually all over the world are coming to play hockey there now. And for them to know it's part of our, part of our recruiting package that, hey, here's our exclusive, orthopedics, Seaview Orthopedics. It's just for the mindset too of people to have that. And again,
awesome.
It's about with the relationship and the success that we've had there.
You guys are easy partners to have too, so that helps.
Yeah, it really comes down to relationships and communication. The fact that we have such a strong relationship means that a kid gets injured, we'll get them in and see them right away. There's
Right.
just no question. You bring them in even the same day. I've seen many hockey players the same day. Within an hour or so of even going down on the ice. So it's nice. I make myself available. Because I enjoy doing it. It's a continuity of care issue as well, so we can follow up on these kids. And, more importantly, they're down in the coaches, the trainers are in the trenches. They I can pick up the phone, call so-and-so and the kid's taken care of.
Right.
And not have to worry about that. So it decreases stress level on their part too.
Right.
I couldn't imagine if they had an injured athlete and they go, oh, now what do we do? Just go to the ER? They're going to sit in the ER for an hour or so? No, we can bypass that a lot.
And I'm sure that reduced time also helps in.
Oh, absolutely. When it comes to an athlete, time is of the essence.
Excellent. Well, that is all the time we have for today. Thank you to our guests for this episode, Dr. David Junkin from Seaview Orthopaedic Sports Medicine Team. To learn more or to book an appointment with Dr. Junkin, visit our website at seaviewortho.com. And thank you to Jim Dowd, our performance and mindset coach of the New Jersey Titans, a wonderful guest today. And as always, a huge thank you to our listeners. If you enjoyed this episode, please subscribe to the Seaview Ortho Podcast and share with other ortho enthusiasts. Be sure to follow us on Instagram at Seaview Ortho or like us on Facebook for all the Seaview Ortho fun, as well as updates on upcoming episodes. Get up, get moving, and get back to quality living with Seaview Orthopedics.